Health varies quite considerably across Europe. So whilst in England life expectancy for men on average is around 79 years, in countries like Russia it can be as low as 63 years for men. The reasons for this are quite complicated, and as geographers we tend to talk about the composition, i.e. the characteristics of the population that live in places, in comparison to the environment, the context in which people live. Now, one of the reasons why Russia has a life expectancy that's 16 years less than that in England is because of things like alcohol consumption amongst men there, which is one of the highest in the world. And that's in part to do with the environment, the context in which there's very little regulation of alcohol. The European Health Championship, which we've produced, looks at all 24 countries that are taking part in the UEFA Euro Championship this summer, and we use male life expectancy at birth as a way of showing some of these stark health differences that I've talked about. There are some unexpected winners and losers from a health championship across Europe. Whilst England does quite well to start off with, winning their group, they eventually get knocked out in the quarterfinals by Iceland. Countries like the hosts, France, also do quite well, but the real shock is that the surprising winner is Switzerland, and this is because they have a male life expectancy of 81 years and a female life expectancy of an extraordinary 85 years on average. Obviously these are complicated problems and the solutions are not going to be straightforward, but there are at least 3 areas which we've been looking at Durham University in terms of our research projects here. One is to think about better public health regulation, so things like regulating alcohol consumption better through things like minimum pricing. A second aspect is thinking about access to healthcare services, so some countries in Eastern Europe do not have as good quality healthcare that we do in England with the NHS. And the third aspect is to think about preventing some of the health problems in the first place, and that requires things like a good education system, lower levels of poverty, something which we still haven't really cracked in England either. So looking ahead, the future challenges for health in Europe are not just about getting rid of some of these inequalities between European countries, they're also thinking about some of the shared health challenges that we have. And the major one here is obesity. The obesity epidemic has meant that over the last 30 years, rates of obesity, particularly amongst children, have tripled. And we're now in a situation where almost 2/3 of our young people are overweight or obese. This is something that each European country needs to tackle individually, but also potentially collectively.